long station, so you guys can participate. We had a caller who actually called us up and asked us if we would ask Danny Tarkanian if he would do a town hall. Now at that time, nobody was doing it. Nobody was talking about it, and the only one that we had heard about was that Harry was going to do the teleconference call, and a lot of people were very upset about that. So on our show, in Danny Tarkanian's first media interview, he pledged to do this event, and this is several weeks ago, and it has come to fruition. They waited for the right venue at the right time. I know there's been some that have been kind of thrown together in between them, and as a result of that, we've seen some things that are pretty ugly at some of these events, and we want to make this different. You have a candidate here who, in the state of Nevada, is willing to actually look at you guys face to face and give you his opinion and what he would do. This is something in fact, to my knowledge, only Shelley Berkeley is the only one who's done one face-to-face, correct?
Hold on. And to her credit, and Danny mentioned this morning when we interviewed him, he did contact her, and she actually made every effort possible to meet her. However, it was a last-minute request, and she also had her town hall last night. So to her credit, she sends her best wishes. She was, with all efforts, trying to be here. So I give her a round of applause for that.
We want to sit down because we don't want it to turn into a frenzy. We want this to be a very respectful, open forum for you people not to only get your views out to a candidate who is running for U.S. Senate, but to also get to know Danny Tarkanian, his viewpoints, his stances. And so we're going to ask that a couple of rules be maintained. And what we want is we want people that we obviously know this is a very passionate issue. We want everybody to be respectful, whether you support or oppose the legislation for universal health care. We also would like to ask that you let everybody speak, ask their question, and then after the question's done, after the answer's done, feel free to applause. No slurs of any kind, please no vulgarity. We appreciate that people didn't show up with any nasty signs. Thank you very much for that. And we want to maintain order, make this a nice, peaceful event. And again, this is a tremendous opportunity for you guys to meet the candidate for U.S. Senate, to have a face-to-face with for the next couple of hours. We are going to focus more on health care. That doesn't mean that we won't get to some of the other issues that you may know Danny later, but we are going to focus on health care for the purpose, since this is obviously the big thing right now. But please, any abusive behavior, you will be asked to leave. We're going to try and maintain nice order, let everybody be amicable here. Understand that a lot of the room supports the legislation, a lot of the room does not support the legislation, and it's all about informing everybody on each side to figure out exactly what should and should not be done and which candidates you will support in the future. So thank you again for coming out. We want to thank you for listening to News Radio 840 KXNT and attending this event. And I'd like to pass it over to my co-host, Heather Kidd, to go ahead and introduce Danny Tarkanian.
Thank you, Casey. Thank you. Okay, right before I introduce Danny, with the nice big long spiel that I've got ready for him, I also want to point out that Dr. Joe Heck is here, and he's sitting right here. And Dr. Joe Heck's here more so that if there's an issue that comes up directly related to the medical field, that he's able to assist with a more informed answer, then maybe we'll allow him to do that. And of course, afterwards, assuming that there's time, if you have direct questions for him or if you want to talk to him out in the lobby. So just throwing that out there as an option. And also want to point out that after I introduce Danny and he goes ahead and introduces himself to you, we'll go through the questions on the cards first, and then time permitting, we'll take your additional questions after that by raising hands, okay? So let's go ahead and get started. Let's see, Danny Tarkanian is the son of legendary basketball coach Jerry Tarkanian and Las Vegas City Councilwoman Lois Tarkanian. He is the husband to Amy, who's sitting right over there actually, and the father to 3 beautiful daughters, Lois, Ava, and Ashley, with another child on the way. Danny was a star basketball player at UNLV, where he graduated with high honors and was the school's first Rhodes Scholar candidate. And upon graduating, Danny attended law school at the University of San Diego. He graduated third in his class, magna cum laude, and was also named to the law review. Danny has been active in politics behind the scenes for many years and has run for both state senate and secretary of state. Today, Danny runs a real estate business and is co-director of the Tarkanian Basketball Academy, which teaches over 350 Clark County kids both basketball skills and life skills, such as work ethic, overcoming adversity, teamwork, winning class, and losing with dignity. And without further ado, I introduce the candidate for U.S. Senate, Dan Tarkanian.
First of all, I want to thank everybody for coming here tonight and spending the Thursday evening here. I understand this healthcare issue is very, very important to people. I also understand the frustration many of you have. I felt it was very important to have a town hall where you could come here tonight, not only express some of your frustration, but more importantly, give us your ideas of how you think we can improve the healthcare program here in our country. I'm disappointed that Senator Reid couldn't make it tonight, but I'm very happy that his organization But I'm very happy that the Organization of America could bring out some of their supporters so they can express their views. This is a bipartisan deal, so we want to hear the views of each party and be respectful to both sides. So we're looking forward to their ideas. Now, Senator Reid and his colleagues have made a proposal on how they feel is best to reform the health care program. I personally have a problem with several of the issues, the most important of which is the cost of this program. This program is estimated to cost $1.3 trillion over the next 10 years. And I don't believe our economy can handle this additional cost. I also don't agree with the public option plan. I understand the advocates for the public option plan feel that it's going to create more opportunities for individuals to purchase their health insurance. But in reality, it's going to create less opportunities. Think about it. The private industries that are in this field are not going to want to compete against the government entity that is supported by the taxpayer dollars. We're going to lose the private competitors and actually have less options here. I also don't agree for this play or pay mandate that is being proposed. Basically what that is the government would impose an 8% tax or surcharge on employers who don't provide health insurance for employees. Now businesses already are struggling to survive. Can you imagine what we do to those businesses if we hit them with another 8% tax? I believe that this proposal that is being presented by the Democrat Party and Senator Reid, they're trying to create 52 new federal agencies, panels, and programs which are going to look and analyze and get involved in your individual healthcare decisions. I believe the healthcare decisions should be left to the individual and the government should stay out of them. Now my proposal on how we can better improve the healthcare Thank you very much. My proposal on how we can reform the healthcare system is based on a simple core principle. We reform health insurance through competition, not by standardization and government regulation. We can provide lower cost and more opportunities to consumer empowerment as opposed to government empowerment. There are a number of areas that we can reduce healthcare without spending one additional dollar. The most obvious of which is to allow individuals in one state to purchase insurance across state lines. There's no reason why someone living There's no reason why somebody living here in Nevada can't go out and purchase insurance from another state if it has a lower cost and it's more efficient for them. What that does is it creates more competition, which creates more efficiency and lower cost. A second area that we can reduce our cost is just a simple tort reform. If we cap the non-economic damages for medical malpractice cases, not only are we going to reduce the medical malpractice insurance doctors have to pay, we're going to reduce the defensive medicine practices that doctors are performing. I don't know if you realize how much we're spending on defensive medicine a year. It was mind-boggling. We're spending $210 billion a year for defensive medicine because doctors are scared of being sued for medical malpractice. Another area we can reduce the cost is to make sure Medicare is the payee of last resort, which is required by federal law. Currently, 13% of all Medicare recipients have other insurance. We need to do a better job of identifying what those other insurances are and getting them to pay and not leave the bill to the taxpayers. Another area that we can reduce the cost is to remove the mandates that the federal government is requiring on insurance companies. Do you realize there are 2,000 mandates that are imposed upon insurance companies throughout the country? Mandates are 20 to 50% of your premiums. I believe that individuals should decide what they want in insurance policies and what they're willing to pay, and it shouldn't be mandated by the government. finally, I believe we should encourage private ownership of insurance. And the way you get more private ownership, well, first of all, private ownership of insurance would allow an individual to keep his insurance throughout his lifetime. Sort of like a car insurance or your life insurance. So if you left your job and you went to another job, you wouldn't have to keep changing. The way to do that is, you need to give individuals the same tax breaks and tax allowances that we provide businesses and employers who provide health insurance. Why should an individual who goes out and buys health insurance for himself, or a self-employed person who buys health insurance for himself, have the same tax allowances that were provided in a multi-billion-dollar company? There's no reason for it, and it would save costs for all of you. Now, today is about you guys. I want to hear your opinions and your suggestions, and we really want a civil discourse. I want to turn the mic over to the questions and suggestions that you have, see what you have to say, and hopefully we can bring something positive out of this evening tonight. And again, thank you all for coming.
Once again, KXNT would like to thank all of you for coming. And just a couple of things. We're going to go to the cards first. Like I said, if there's any time after that, we will most definitely take hands. We will control the microphones, so please don't grab the microphone or anything like that. And also, when you come up here, please make a concise statement, question. This is not a time to rail on for a half hour, 45 minutes, something like that. We get you're passionate, we understand that. But it's about learning what Danny Tarkanian wants to do and about him learning about what you guys want to do. So please be concise in your statements and questions. I would like to ask Dave Warren to please come up. Dave, thank you for joining us. What is your question for Danny?
Well, I'm retired military myself, and I'm concerned mostly about the cost of this program that we've got. If the way I see it right now is that we're either going to have to raise taxes or we're going to have to cut services. Now, being retired military and also on Medicare, I'm under the military TRICARE system, but Medicare is the first primary insurance that I have. Now, if we don't raise taxes, we're going to cut services. It brings back the diagram that Ezekiel Emmanuel brought out, and also about these possibility of cutting the services for the elderly and also the young, which apparently Sarah Palin called them death panels. Now, there's a lot of us retirees here that fall in that category, and of course we're concerned about it. What's your opinion on that?
Thank you, Dave.
Well, that's one of the concerns we talked about with this plan and the cost of it. Well, one is we're going to cut services, but more importantly, you're also going to reduce the competition, which would provide a lower cost. It's a valid concern. It's one that we have to be concerned about with this plan.
Heather?
Okay. Oh, and just one last little note, if you, for any reason, are still filling out a card, please try to include your name. The ones without a name, we're going to go ahead and just read to the best of our ability with your handwriting. So just wanted to let you know. For instance, we'll start with this one. One of the things I've been hearing about is that they have huge bills like cap and trade or healthcare, and it's that lobby groups have been writing these bills. If you became our next senator, would you speak out against this practice and insist that congressmen and senators write their own bills?
Well, one of the big problems we have with our government right now, and something I've been an outspoken opponent of, is the influence a lot of this have because of the donations and the contributions they're making to these politicians. Now, we walk a fine line because we have a First Amendment right that gives everyone the opportunity to contribute to a candidate of their choice. But when you have these big businesses, and frankly, just look at the bailout of the financial institution, you look at what's happening now with the healthcare system, you have these legislators who are advocating positions by these lobbyists that have given them hundreds of thousands, if not millions of dollars, and there's something wrong with that system. We need to put the citizens that we're representing first, not the lobbyists and their money first.
Kellyanne Scalise.
Over here.
Once again, thank you for joining us, and what's your question for Danny?
One of my concerns, and actually you addressed it in your opening statement, I think there definitely needs to be reform to our healthcare system, but I'm hoping that we can lean more towards taking healthcare out of the hands of employers and giving it back to individual families. You know, my family of four, we'd much rather have the choice to go out and get, you know, had to be our decision. Do we want full coverage that's going to cover everything from soup to nuts, or a catastrophic policy only, or somewhere in between? And, you know, you said already that that's something that you support, and that makes me very happy, because when we see free market competition like that, obviously I think everybody wins.
Yeah, well, first of all, you have two lovely daughters, and I got two-in-laws, so it's nice to see you here. I certainly agree with that position. I think that's where we need to strive to get private ownership of our insurance policies, as opposed to being reliant upon our employer. I'll give you a perfect example. When I was working at Fresno State with my father, we were under the health insurance plan there. When we left, I went back to Las Vegas. I started my own business, and my wife became pregnant. And when COVID ran out, we had to go out and try to buy new insurance. Well, because she was pregnant, it was very few, you either going to pay extremely high premium, or you had to pay for the cost themselves. We had to pay the cost ourselves. If you have private ownership of insurance that carries with you over a period of time, you don't run into those problems. I believe that's a big thing that we need to strive for with our healthcare reform.
I have one here, it just says Paul from Henderson. Paul, do you know who you are? You wrote on this pink card? Or I'll just read it for you? Okay. Does anybody see it? Oh, okay. Mr. Tarkanian, do you believe the children of the wealthy deserve quality health care more than the children of the poor? And if not, how can you not support Obama's health care plan, which would make quality, affordable health care available to every American citizen?
And again, I think that...
Wait till he answers.
And again, there's always going to be difference of opinions here, and we don't want to degrade any question, and I certainly aren't going to do that in my answer. The question is how you interpret the health care plan that Senator Obama and Senator Reid are proposing. As I mentioned in my open statement, I believe we're going to have an increase in cost because we're going to eliminate the competitiveness of the healthcare industry. Once you have government owned plans involved with competing against private entity and the private industry, those private companies are going to get out of the business. They're going to feel there's no way they can compete against a government entity, and we're going to be relying upon just the government entity to provide the service. Now, this is an important fact to understand. All these countries that have socialized medicine now, the vast majority of them started with a voluntary government plan, and then it evolved into a full socialistic healthcare plan. I don't believe there's many people in the country that want to have socialistic healthcare here in our country, and I believe the government option is the first step towards that. History shows that it is.
Dr. Lawrence Rubin, I believe it is? I'm coming. Hold on.
Actually, I'm here. The question that I would like to ask is this. You seem to oppose government regulation of healthcare, just stated broadly.
Very broadly.
Yes, very broadly. Yet at the same time, most of us, as I look around here, are senior citizens. And we would hate to be giving up our Medicare, which is a government-regulated program. It's a government-regulated program that goes out into the health insurance industry and says, look, we're going to be the umbrella to make sure that this program is run right. But we're looking for you, Blue Shield, and you, Aetna, and you, whatever else insurance company, to actually get the business, and that's how it runs. It's got its faults, but it seems to be working well. Any comments on that?
Sure, thank you. That's a great question. We really need to have a safety net for the people who can't afford their health insurance, and that's what Medicare and Medicaid are for. And no one is arguing against that. The problem is, you look at what's happened with Medicare. Doctors don't want to service that plan because they're limiting what they're going to get paid for there. The options are more limited to Medicare, and you have less choices there. Individuals don't have as many options to pick which doctors they want and the cost they're going to have. We do need to have a safety net for the poor and the elderly, and I'm all in favor of that. My opposition is to force the 200 and some million people who have their own health insurance into a government-oriented plan when they don't want it, and they're happy with what they have.
Okay, I have a question here from Dick Collins.
Yes.
Casey, will you make sure you get the mic?
Hi. My name is Dick Collins. I'm from North Las Vegas. And I have a couple of questions, but first I want to preface it with the fact that the vast majority of Americans want health care reform.
Hold on.
There's many, many different ways of reforming health care. You've mentioned a few of them that are very positive. You've mentioned a few that I disagree with. However, people still want health care reform. My question is, what is your plan, if elected, to institute your health care reform?
Well, first of all, I mentioned about 5 already, and I'll go through a couple more, but before you can sit down, explain to me which of those first 5 that you opposed.
The first 5?
That I mentioned already.
Okay, the first one is about the amount of money that it would cost the Americans if we had a public health care plan. Also, because there's a lot of differences of opinion on that, the vast majority of the people that I've run across with and who have studied with have found that the amount of money that they would be saved by the competition, you don't have, right off the bat, in the public plan, you don't count in the 35% average profit of the insurance companies. That's to start with. Then it would also create these companies to become more competitive. Now, you said people would be able to cross state lines to purchase insurance in other states, which is a good idea. That I agree with.
Thank you.
However, your premise behind that of opening up the competition, I disagree with, because the opening up the competition, there's only one way to do that, and that's to have more companies. And the large insurance companies today are gobbling each other up. United Healthcare, for instance, they're gobbling up all these other insurance companies, and they're creating individual monopolies. Kaiser Permanente is another one. Some of these companies are very, very good. Some of these companies are only interested in one item, like the bottom line, and $154 million the CEO of United Healthcare earned last year to pay taxes on. Thank you.
Well, thank you. The first point I want to address is the cost. You saying that you dispute the fact that the Reid-Obama healthcare plan is going to cost $1.3 trillion over 10 years. Now, that's the estimate that the government has made. Now, understand, there has never been a government healthcare plan that has ever come in within the projected cost it would be. Medicare came in 10 times higher than what they projected the cost to be. Currently, they're projecting this plan to be $1.3 trillion. If it's like Medicare, it's going to be $13 trillion. It certainly isn't going to be less. It's never happened. Second of all, I agree with you. Competition is the most important thing. Now, if you believe that having a government entity come in and compete against private enterprises will create more competition, then you should be in favor of the Reid healthcare plan. I believe history has shown itself that government competition runs out the private competition. It only makes sense. Why would a private company who does not have the taxpayer dollars behind them want to compete against a government entity? We have the greatest economic society in the country because we foster competition and we create opportunities. The more competition we get, the more efficiency we get, and the lower cost we get, and that's what we need to strive for. If you believe a government program creates more competition, then you should believe in the Reid plan. I believe private competition is what we need.
I would actually like to follow something up kind of on what he was saying, if I may, Danny. We know that from the major polling firms, roughly between 79 to 85% are pretty happy with their current health care. But there is clearly a large chunk of the population that is not happy with it. There's also, most people in this room will say that there's probably at least one thing wrong with healthcare that could probably be tweaked. Whether or not they want to mess with the entire system is debatable. Have you looked into some of the things that people are mostly telling you that they believe is wrong with the healthcare system, and how would you fix those?
Well, people there's several of them that we mentioned. One of them was the COBRA issue that I talked about. When I was on your radio station, actually, although it was with the morning show host, one of the callers called in concerning COBRA, and she had just left her plan. She had just left her company and purchased COBRA, and her COBRA was running out. COBRA, for you that don't understand, is an opportunity for you when you leave your employment to keep the same health insurance you have by paying 102% of the cost that the employer is paying. Well, it only lasts for 18 months. This lady called up and said, my COBRA just ran out, the 18 months happened, and now my insurance went from $300 a month to $600 a month, and they're excluding my pre-condition condition. What can I do? And that gets back to, do we want to have employer-based plans where as long as you're with the employer, you're okay if it provides health insurance? Or do you want to have personal health care plans that you can keep with throughout your life so when you make changes, you keep that plan and you don't run into these problems?
Is it Benny Rhoda? Rhoda?
Good evening. Although we are a community that is compassionate and a country that's compassionate, we've taken on a responsibility of taking care of people who are here illegally. Yes. We spend in one of our local hospitals at least $20 million. That's just one of them. If you had the power or the ability, how and what would you do about that?
Well, that's really a great question, particularly concerning the story that just came out about UMC and the costs and the burden that's being imposed upon our hospital there and the lack of facilities available for everybody else. This is a very divisive issue. On the one hand, we have people here who are ill and they need treatment. On the other hand, we have citizens who are here legally who need treatment. You've got to side with the citizens who are here legally who need the treatment.
Okay, and before I read this question, please, there's a nice lady over there who keeps holding her card up, and I don't want her on her phone.
I'm sorry about that.
It's okay. Okay, why did Obama want to pass the government health bill before they adjourned for recess, when it took him almost 6 months to pick out a dog, and is picking out a dog more important than the government health bill?
Again, that's sort of a sarcastic question, but I think the thing is this. The Democrat Party, and again, I'm running against Harry Reid, so I'd like to address my issues with Harry Reid, and he's always promised that he's going to pass health care reform before the end of the year. They badly want to pass something because they made the statement they better pass it. They would rather pass a bill that many of the legislators who voted on in the House didn't even agree. They want to pass a bill before this public discourse like these town hall meetings to get it passed. Because sometimes you get in office and you make promises and you want to show your constituents that you're actually doing something. I believe we should have these type of town halls. We should listen to people. Hey, the legislators of Washington, D.C. don't have all the answers. I certainly don't have all the answers. It's important to hear each of your views. And when we're talking about maybe the most important legislation of our time, shouldn't we take the time to learn and listen and get the best legislation as opposed to rushing something through?
Irene and Bernard Silvez.
I think they're in front of you there.
Go ahead, what's your question?
legislative act as I have seen is over 1,000 pages, and I have downloaded and tried to read it, and I have to admit that it's very difficult to understand. Do you believe, as an attorney, and have you read it, and do you understand it, and do you believe that the legislators who are going to make a decision on this are smart enough to know what it means?
The first part of that answer is that when the House voted on this, I don't believe there's one legislator admitted that he read, acknowledged that he read the bill. In fact, every one of them came out and said they hadn't read that bill yet. I believe there was one just recently who said he read it over now and he's doing it a second time because he hasn't quite understood all of it. We've got the bill, we're trying to review it and understand it. We're in the process of doing so, but it takes time. It's not something we're going to rush through in a 2-week, 4-week period.
Okay, I'm going to take this question right here from the young lady up front who was unable to get a card, but it'd be kind of difficult to come in. So go ahead and ask your question. Say your name if you would.
Hi, my name is Karen Benzer, and I'm the Southern Coordinator of Nevada for MoveOn.org. And,
Okay, seriously? That was what we asked you not to do.
what I find in this room is complete biasm, and the fact that you guys boo is just really pathetic.
Do you have a question though? Because she asked me a favor. Okay.
I would like to respond to that. You know, we have done everything we can to have a civil discourse here. In fact, I personally tried to greet everybody coming through, and I thanked all of the REACH supporters included for coming here and giving us their opinion. Now, this is an emotional issue. You're going to have some people that are going to burst out with whatever their feelings are. We tried to keep it, in fact, if you look at everything on TV, this is about as tame as you
I
can
think
get.
this is probably the one where we
We
can mostly get an app.
invited Senator Reid to be here. We invited Congresswoman Berkeley to be here. We wanted this as a bipartisan deal. The opportunity was there, and they haven't come. And obviously, if there's more supporters against the bill, you're going to have some stuff like that. I actually am very proud of the way this crowd has handled themselves so far.
We don't mind any of your reactions, positive or negative, but just please allow people to get their questions out first, okay? And then we can react. I have no problem with that, but we want to be kind to each other.
So far, this is definitely the best
Oh, I'm so
that
impressed.
we've
Thank you.
seen, especially locally. So thank you for being civil.
I'm actually in a wheelchair. I have MS. I'm disabled. I can barely move one hand, and I had private insurance all my life, and it failed me miserably. Now I'm on Medicare. I love Medicare. They come to my house. They help me out. My child has autism, and that's a preconceived.
We're very thankful that we have that safety net we discussed with Medicare.
Would you like me to come back?
It's not the rich, it's the middle class.
I think she said it's the middle class who can't afford to get the care that they need. And so, do you want to just ask, why he's opposed to the legislation then, or?
Yes, that's the outcome our country. Capitalism is based on cabinet enter, buyer beware. And when you have the only private corporation running something as important as healthcare, and you don't have the government making it plain, an even playing field, then you're going to have corruption, and you're going to have, you guys keep saying that the government, we don't want government involved and stuff like that. Well, the private insurance give you a list of doctors, they tell you what's covered and what's not covered, and they're the one that I consider the bad guy in all this. And I absolutely 100% support a public option so that 50 million people, that's our moral duty to make sure 17 million children have insurance and they don't die for no reason.
Okay. So just she pointed out that she thinks that in capitalism and in a private market system that leads to corruption. So why would you think that would be a better option maybe than the public option? Is that an okay way of rounding that off? Okay, so there's a question.
And again, that's why America's great. We have different opinions, and everybody can have a viewpoint. We have had the greatest economic success in the history of society. I believe that economic success is because of a free market capitalistic society. There are a lot of people out there that feel government can run programs better. I mean, we look at the DMV, I'm sure most of you are happy with that. We look at the government, I'm sure you're happy with that. I just am not. I understand if there's a difference of opinion, we'll probably vote the other way. But the people that believe in my position, I hope they vote for me.
Okay, sir, go ahead.
Good evening, sir. My name is Sir.
Sir.
And as you can see, I'm affiliated with KDON. But my question to you is this. Now, I'm going to get directly to the meat of the argument here. There's been a lot of misinformation that's been disseminated throughout all the radio stations, all the talk shows, and all that good stuff. First of all, we were told that the bill consisted of covering illegal aliens. That's not true. Secondly, we were told that if you have a certain illness and the government don't want to take care of it under their plan, they will tell you to go and unplug your grandmother. That's not true. We were told that there is a provision in the bill that was to where is it, if someone wanted to have an abortion, that was in the bill. There is so much misinformation out there, and so many people are so confused about what's going on. My question to you is this. If you are elected to take Harry Reid's place, and I am a supporter of Harry Reid, if you are elected to take Mr. Reid's place, what would you do to ensure people such as that young lady over there that's afflicted with that particular disease, what would you suggest concerning a public forum to help her, as opposed to a private forum, which we already know that the private insurance companies already dictate what doctors you can see, what kind of medicine you can take, what hospital you can go to, and if you have more than 2 illnesses in a 12-month period, guess what happens? They will cut you off. So what do you propose to combat that?
The competition being so highly KXNT to come to our event, but Danny, your response?
First of all, I'm not going to address the misinformation that you claim that has come out that hasn't come out from my mouth first. I can only talk about what I've discussed. We have listened to the young lady right here tell her how satisfied she is with the Medicare health insurance that she is being provided. That shows that government program has worked for her. The question is, what's about the other 200+ million Americans who have private health insurance plans, who the programs are working for them? Why should we impose government health care for those individuals, those 200 million individuals who are happy with the health care plan?
If I may, Danny, I'd like to actually follow that up. The federal government's own numbers places the number of American citizens, it's an important distinction, the number of American citizens who do not qualify for any assistance with their medical care right now and who want it but can't get it on their own at 3.3 million. What can you do as a senator, or what do you plan to do as a senator, to ensure that they do receive some kind of coverage?
Well, that number is really in debate. I know that the Democrat side has argued it's 46 million. The reports that I have is that there's 8 million Americans with chronic illness that have not had insurance over a 2-year period. We need to do something to provide insurance for those individuals. I mean, we are a benevolent society. We want to help those people. But again, you have to weigh, are we going to destroy or damage or hurt the insurance that is being provided to 200+ million Americans that are happy with it, to try to help out this 8 million that don't have insurance? Now, I've discussed a few ways that we can increase competition. I'm a big believer in capitalism. I believe if you look through our society and see the success that we've had. I mean, why are we such a great economic society? Is it because Americans are greater people than the British and French? No, it's because of our capitalistic society. We foster competition. Every industry that fosters competition, you have more efficiency at a lower cost. I believe the reform that we should be looking for in healthcare is to create more competition, to create more efficiency, which result in lower costs. When you bring government into the mix, you're going to create less competition, which raises your cost and has a more bureaucracy.
Okay, we have Fran Sanford. Fran? Does anybody see Fran? Fran Sanford? Okay, I'll ask the question, I suppose. Will Congress, what? Yeah. Mm-hmm. Oh, okay. Or it might have been Frank. I'm sorry. I don't know. Here you go.
Congress right now, the elite in Congress don't have Social Security. They have their own retirement plan. Now, will Congress in the unions that they now control be forced to take the public option, or will they be given their own elite plan? Number one.
Wait till the question's over, please.
And number two, where in the Constitution does it give the right for the government to impose a health care plan on us, outside of maybe the interstate commerce thing, which is so general and so broad that it should be discarded? Thank you.
Let me answer the last question first, and that's been a big issue that has come up. And I was asked that on the radio station when I first announced. And that was, is health insurance a right to every citizen here in our country? And, you know, we're a benevolent society. We want everyone to have health insurance. We should strive for that purpose. But is it a right? And as a right, is it a burden then on everyone else? I don't believe there is anything in our Constitution that creates this right. It should be something we strive for. Now, with respect to your second question, or your first question, you actually took one of my talking points that I threw out of my speech because I thought it was too long. And Congressman Heller actually had introduced a bill that would require all of the congressmen to accept this public plan that is being proposed. And Congress killed the bill before there could be a vote for it.
All right, Danny, I have a question for somebody in the audience that I can read. Did you listen to President Obama's talk this morning? According to him, 2/3 of the $1 trillion will come from existing, poorly managed, yet already funded programs. In other words, they will shift monies that they already have to pay for 2/3 of this bill. Your response?
I didn't hear President Obama's talk because I was out there actually getting introduced to your radio station. So I missed it. But how many times have we heard the promises that this plan is going to be paid for with another plan, and in reality you pass it and all of a sudden it increases the budget back where it's at? The people, the government program themselves have looked at this plan, and this is a nonpartisan group, has said the plan is going to cost it's going to increase our deficit $1.3 trillion over the next 10 years. And again, every time we've had a government program in healthcare and we've made estimates on what it's going to cost, it's come in way over. As I mentioned, Medicare is 10 times that much. I seriously doubt that these cost savings are going to decrease a $1.3 billion deficit.
Okay, Pebble Falconer? Pebble? Okay, I have your card. I hope you can remember all this. Okay.
I'll shorten it up. I saw Obama on television yesterday, and he said something that was very upsetting that affected me and my family about diabetes and amputation. And he suggested that doctors would actually do an amputation on a diabetic to increase monetarily their bank account of $30,000. And I have a brother who had 6 surgeries, starting with his foot and ended up with his thigh, and he lived an extra 30 years because of that surgery. And I wondered how you felt about villainizing the doctors this way, and if you would think that a doctor would actually do that.
My father just had a serious illness. His legs have been bothering him for the last 2 or 3 years. He went to all these different doctors. They couldn't find out what the problem was. And about 5 weeks ago, he was walking and he fell and hit himself in the face and shattered his shoulder, and went into intensive surgery. The doctor told us he didn't think he had much of a chance to make it. It was going to be very dangerous. And that doctor went in there and he took out a bone spur that was intruding upon his spine 3/4 of the distance. And he did it, he came out, my dad survived, and when he came out, I gave him the biggest hug, my sisters were kissing him. If you can't appreciate what doctors are doing in our society, and you want them to
Teresa Crawford. Go ahead.
Best wishes to your dad. I'm an RN and I obviously care for elderly patients who do very well with surgery and intensive treatment. What I wanted to ask is, also I want to say that I agree with the American Nursing Association that access to health care is a basic human right. It's part of just dignity, and to say that some people deserve it and some people don't, I'll never agree with. But thank you for allowing me to speak in this forum. I actually did visit Shelley Berkeley's forum last night, and she explained quite a few things that are in HR 3200, apart from the public option. I want to know if you agree with any of this. Eliminate the donut hole in Part D. That's given some people catastrophic charges.
You're going to ask questions of specific instances like that I can't respond to.
Okay, that's all right. HR 3200 has quite a few elements that will increase the number of uninsured people without going to a public option, like increased access to S-CHIP and Medicaid, allowing children to stay on their parents' plans till age 25. As a military dependent, I was on my parents' plan until I was, I think, 23, as long as I was in school. Expanded funding for community clinics, the donut hole, as I said, expanded education for primary providers, and also, which I totally agree with this, eliminate pre-existing conditions, rescission, you can explain that if people here don't know, and eliminate lifetime caps that a lot of people come up against. And you ran across that with your wife's pregnancy while you were on COBRA. Is there anything in HR 3200 you run across that you like?
Thank you. As I mentioned, we have not reviewed the full bill, as have most of the legislators that voted on it. It's a very comprehensive bill, and before I want to take a position on each of those issues, I would want to have full knowledge of them. Now, there are going to be some things in that bill that I'm going to agree with. There are things that need to be changed in the health care. And I strive myself on trying to listen to each side, understanding each person's point of view, and there may be things I'm wrong on, but some point of view will change my mind. I'm open to listen to these suggestions that are in the HR bill, and if they would benefit our health care, I would be in favor of it.
Tom B. Just the last initial B, Tom B. Oh, Casey, I think he's right here next to you.
I think you pretty much covered everything in the first part of your first 5 parts that you talked about. The main thing I'm concerned about is the trying to railroad this bill through like it's got to be done yesterday, where it's not.
Again, I agree with this. This is a very complex issue, just as the previous questioner had raised some points. We need to evaluate it, analyze it, have these town halls where the people that are most affected can voice their concerns, both for and against the bill, and come up with the right solution. There's no reason to rush through the most important piece of legislation that is being put forth to our Congress in our lifetime.
Rob Disney.
So the gentleman over here mentioned that there's no right for healthcare within the Constitution, and you agreed with that, and that's why you believe in privatization and whatnot. I was wondering if you could parallel that along with the idea of public education, and why there's no constitutional guarantee of public education either. So if so, would you agree with the idea of privatizing all of education in addition? And if not, could you explain to me what the difference is?
Well, first of all, I want to correct you. I didn't say that the reason there's no right is why I believe in private enterprise. I believe that private enterprise can produce the best options, the best quality at the lowest cost. I'm also a big believer in education. I think one of the biggest problems we have here in Nevada is that we don't have enough competition in our educational system. We have one teachers union that controls who's going to be employed by each of the schools and the school districts, even the charter school districts. And I believe that we should reward people who perform better in the jobs and be able to get rid of people who aren't performing well in the jobs. It's a competition. I have 3 young children that I have in a private school right now, which is really tough on us financially. But I believe our public school system is failing us here, and part of the reason it's failing us is the lack of competition that we have out there.
Okay, I have one from Joe L. Joe? Okay, Casey's right behind you, and also a veteran who was awarded the silver medal. So.
Actually, I'm not here on either side. However, we probably spent the night in the same place as my dad was getting his doctorate at Fresno State, and we used to come see the games all the time. A lot of Bulldogs. However, 12 years ago, I owned my own business. My business would make 1.2, 1.5 million a year. I would pull down 30 to 40,000 a month. I provided health care coverage, Kaiser, full coverage of Kaiser, dental, vision for myself and all my employees. And then I had a catastrophic accident and ended up losing my business, losing all my insurance, lost everything, and now I live on a fixed income. I was on an Air Force authorized search and rescue mission. My medical is everything connected to my accident, let me specify that first, is covered by the Department of Labor. Anything else, I'm just SOL. I don't pay it. I can't pay it. But the Department of Labor, the part that I'm entitled to, the part that I'm supposed to be covered for, I have been battling for 12 years to get the procedures that I need. I contacted Senator Reed's office. They're still working with me right now. But the first response I got from them was basically go hire a lawyer. That was not a very good response. I'm working with someone over at Senator Reed's office who is actually being very responsive and very helpful. So I can't say anything. I'm hopeful it's a skeptic. Now, I am not eligible for any, even if I could afford it, I'm not eligible for any health care insurance. No one would touch me with a 10-foot pole. I cannot get the procedures that I'm entitled to that the government should be paying for. And I guess I have a couple questions. What do you do for people like me in my situation where I used to be insured? I lost my insurance because of a catastrophic accident where I was no longer able to continue my business. And also, if the government, the second question is, if the government gets further involved in our health care, what's to stop the same bureaucratic red tape that I'm going through right now from becoming a larger bureaucratic red tape that all of us are going to have to deal with?
Well, and that's the point I was making. When you get government involved in these issues, you run into bureaucracy, the high costs and delays of those things. Now, the main question, and really feel for the situation you're in, and my proposal where you can have a private health insurance that you carry with you throughout your lifetime, like your life insurance, is what we need to have, where they can't drop you because you have a precondition or that you have a condition that incurs with that insurance. It's just like if you have a life insurance, I have a life insurance, and if I catch some illness, they can't all of a sudden drop me. So we need to have something similar like that for health insurance, for people who incur those type of illnesses, and they're going to be covered anyway.
I can't get any at all now.
No, I know, that's one of
I
the...
got one in that place, but now I can't, no one will touch me because it's after the fact.
And that's the point. I'm saying there is this problem, and no one here in this room, I believe, has said there isn't any problems with our healthcare programs here in the country. That is one of the key problems we have, and we need to correct that problem. I believe having individual-owned plans that you can carry with you throughout your life, where they can't drop you because of an illness like that or an injury like that, is a solution to that.
And Danny, what about when you have a situation where you have somebody like this gentleman who's kind of basically getting the shaft on both ends from the private sector and the government sector? The option to not be dropped from your insurance is a good option. Will you support any legislation that allows somebody with a pre-existing condition to be required to be covered, at least, if not a limited draw of companies, the whole market?
I think that's what, I missed the beginning part of your question because I had to get something to drink, I'm sorry. But I believe that's similar to what the gentleman who just spoke said. I certainly believe, and I think it's very, very important, that someone who has insurance, and in particularly if it's an individual-owned insurance, that that the insurance companies cannot drop that individual just because he has a condition that's going to be more expensive down the line. I would certainly be in favor of that legislation.
Now what about, because I know you're getting a drink, what about if you have a situation where like he can't get insured now? Would you support legislation that would allow him to get insured from his point now, where he already can't get the public to pay for it, he can't get the private sector to pay for it? Would you be able to support legislation that would require at least a small pool of companies, or maybe even a small public option, like a safety net for somebody like him who already has a pre-existing condition?
Yes, I would. And there are some states that have that regulation. I was looking for my notes to find out which one it was. But there are some states that require that. I would certainly feel that we should make that across the board federally.
Mary? Boulder City? Mary from Boulder City? Okay, read it. All right, Danny, this is for Mary. You know the public option is an option that's underlined, and no one will be forced to choose it. A lot of the people at this meeting seem to think that it will be mandatory. In the interest of honest discussion, will you clarify that the public option is just that, one option?
Yes, it's a public option. They're not required to take it. Employers aren't required to use it. But how about this? You have a government-sponsored program that's supported by taxpayer dollars. They're going to come in and create this health insurance for a low number compared to what the private sector is being able to afford. Then all of a sudden the private sector says, hell, I can't stay in business like this. I'm losing money if I'm competing against a government program, which is subsidized by taxpayer dollars. I'm going to get out of the business. What happens when all these private entities get out of the business? You know what happens? We have socialized healthcare. That's how the healthcare has become socialized in Europe and Canada. It started with a private, voluntarily public option. I would like to bring up gubernatorial candidate Dr. Joe Heck to at least speak for a few minutes. He is a doctor and he has a lot of knowledge on this. He's been sitting patiently for the past hour. Can we bring Dr. Heck up?
Well, thanks, Dave, for the opportunity to be here. And I apologize for the attire, but I actually did work at the ER at UFC all day today since 6 a.m. and came here directly from work. So I can talk to you about what it's like to be on the front lines of providing emergency care here in Nevada and what some of the impact might be of this bill. And I think the points that have been brought up on both sides tonight have been great points. To the nurse who talked about what in the bill do you like? There are things in this bill that will be beneficial for healthcare. There certainly are things in this bill that would be beneficial for healthcare. For instance, there's a requirement to have an electronic medical record. That is something that's very important to you as a patient and to me as a physician. Because when you come into my emergency department and you can't tell me what's wrong with you, and I have to run all these tests to try to find out what's going on, only to find out when your loved one shows up 2 hours later that you just had all those tests 2 days ago. We've just increased the cost of healthcare. So an electronic medical record is something that's critically important, I think, to lowering the cost of healthcare. The question was brought up about tort reform. Now, this was something that from the beginning, President Obama said would not be on the table. It was not even open for discussion. Do you know that the vast majority of the United States public wants tort reform? We didn't even have it on our list. Tort reform is a critical issue. It drives down the cost by decreasing the cost of doing business for physicians, and it drives down the cost by decreasing the defensive medicine practices that Danny talked about. And I can tell you, at UMC we have residents, and it's my job to try to train residents to practice medicine that's in the best interest of the patient. You don't know how hard it is when they come in and they have every test checked off. And I say, well, why are you ordering all those tests? Well, because I don't want to get sued. Well, wait a minute. That's not what we're here for. We're here to take care of the patients and order the tests that the patient needs to take care of them, not to protect ourselves. So we need tort reform. We do need that. There was something in the bill, and I have read the 1,018 pages. And I can tell you it was actually easier than reading the last executive budget, which was over 2,600 pages. But there's a piece in there that was brought up about increasing primary care physicians. The big piece that's not in there is increasing the number of healthcare providers across all fields. We have shortages of healthcare providers, whether it be nurses, physicians, respiratory therapists, physical. I can assure everybody in this room today, but I guarantee you'd still be waiting for 3 months to get an appointment because there's not enough providers to take care of you. That's not in the bill. That's not in the bill. So there are other things that they want to put comprehensive healthcare reform as the title. It's anything but comprehensive. Okay, it's an attempt at trying to put through certain aspects of healthcare reform. And it probably is better to break this up into small, chewable bites and looking at each particular issue, whether it be tort reform, whether it be increasing the number of providers, whether it's increasing access to affordable health care insurance, and do it in pieces, where everybody has the opportunity to read the bill, understand it, come up with options. But coming across with something with just a title of comprehensive and not truly being comprehensive does a disservice to all of us. So there are other things in the bill that need to be, a lot of people want to talk numbers. I can talk numbers about this all day long. There's been a lot of press lately about the dialysis situation at UMC. My first 7 patients today, first 7, were dialysis patients who showed up in the ER because there was time for their dialysis and they were just dialyzed 2 or 3 days ago. I mean, this is something that's real and it's happening every day. And it costs $2 million a month just at UMC. So there does need to be, and I'll tell you that, I can't say whether or not they were illegals or not. I don't know. I truly don't. I mean, I can say that 5 of the 7 had Social Security numbers. So I know at least 5 of the 7 were probably legal residents or here legally. But they still had no place to go for their dialysis therapy. And they show up in the emergency department, the most costly place in the world to come and get your care. I mean, so we do need to make sure that we have access to affordable health care. The question, everybody likes to bring, especially politicians, it's always for the kids, right? We do everything for the kids. Well, right now, there's the state children's health insurance program called SCHIP. That's a program that works. Now, I can tell you that in the state of Nevada, we have twice as many kids unenrolled that are eligible than we do enrolled. We need to enroll those kids in the program that's there, not come up with another program. We do need to enroll. So you want to say that it affects the middle class? Well, SCHIP, after the last congressional bill, covers children in a family that's at 400% of the federal poverty level. 400%. For a family of 4 this year, that's roughly $88,000. So if you're a family of 4 making less than $88,000, and you have children, your children would qualify for a program that's already there. And that's the big charade that's going on with this number that's being put out there about the number of uninsured. Yes, they're uninsured. But you know what? There's options out there for people. Another big issue that we've talked about is what in the healthcare industry we call the invincibles. It's the 19 to 29-year-old male who's working, good job, has insurance available to him at a decent cost, but he doesn't buy it because he's saving up for his Harley Davidson. Okay? It's not going to happen to me. I don't need insurance. Okay? In Nevada, that's roughly 75,000. Just in Nevada, roughly 75,000 of the 450,000 uninsured people in Nevada. It's there. It's affordable. It's their decision not to buy it. Are we going to force them into some government program at taxpayer expense? Yes. Okay? And the question is, should we have to force them into that at taxpayer expense? It's there. It's affordable. They make that conscious decision. Okay? So these are the things that we need to look at. What programs are there that we could put people into? What is the true uninsured number of people in the country? And it does whittle down to about 3 million, which is 1% of our overall population. 1%. I mean, when you truly look at eligible people that truly do not have an option, it's about 3 million people. And then you look at who makes up those 3 million people. Sorry to say that the vast majority of them are homeless people. They're unaccountable to anybody, really. How do you get them into a program and get them health care? But it's 1% of the population. Are we going to change a system for 1% of the population when 99% of the population has an option that's already there that they just might not be taking advantage of? That's where we have to concentrate our efforts. And I know that that's what Danny Tarkanian will do when he replaces Harry Reid.
Casey, is it my turn or your turn?
I will let you go.
Before you ask another question, I just wanted to give you another real life experience because this was something that I was going to discuss in my opening, but I didn't want to take so long. But Dr. Heck brought it up. The electronic medical records and how important that is for our society. We need to get to the 21st century. My father, who I mentioned, had that fall. He had been seeing doctors for 3 years all around the country, the Mayo Clinic in Arizona and Fresno and Las Vegas, down in San Diego. Well, he had to have that surgery done, and we're trying to collect these records from all over the country. My sister, who's an RN, she's frantically trying to get these records. If they were electronic, you could get them there, and there wouldn't be these problems. But what's interesting to note is these electronic medical records actually have reduced the visits patients have with their doctors. In Hawaii, Kaiser did a study, and they determined that patients have 20% less visits with their doctors when they have these electronic medical records because they can solve a lot of these problems over the phone by just communicating with the doctors. So that's another area where we can reduce the cost without having to incur additional expenses to our government.
We'll keep those records.
Okay, I believe this says Audrey Howman. Audrey? Is it Audrey? Oh.
I got her.
Actually, my question has been answered.
Oh, you're good?
Okay, question has been answered. All right.
So, there's one here that just says at the top, I'm an optometrist. Do you know who you are? The question basically then in that regard was whether or not under this plan, you know, basically in your understanding, if younger people versus older people would be evaluated and given preference in treatment, and whether or not that is really in the bill and what you think about that.
I don't believe that's part of the bill. I haven't heard that in the discussion so far. Do you know that?
No, there's nothing that I've seen in the bill that talks about preferential treatment for one age group over another.
Is it Denise Warwick? Go ahead.
My question had something to do with the other woman who brought up the thing about the diabetes and amputating limbs. I'm a respiratory therapist. I've been in the field for 36 years, and I've watched the medical field change tremendously over that time. I am very dismayed by President Obama's misinformation and all of his advisors who are advising him, where he can make those kinds of statements about physicians. I am so dismayed by that and don't know how is that going to be portrayed then in this overall comprehensive healthcare reform that he's advocating. For one thing, physicians, the physician who would do the amputation is not the physician who would be treating the diabetes. So one is not going to benefit over the other. And lay people in the field don't know that. And so they believe this. And it's so, I'm horrified by the fact that is being said about the physicians and the other ancillary healthcare workers in this country, who have all gone into that field because they want to take care of people.
Is there a question, or is that more just a statement?
Well, how are we going to counteract that?
I think we should let Dr. Heck answer that one.
Thank you very much.
And I certainly appreciate that sentiment, because it's a difficult issue that to be working on the front lines of healthcare, whether you're a physician or a nurse or a respiratory therapist, anybody who is indirectly or directly being maligned by this healthcare bill, by saying that we're doing this to protect you, basically from the people that are there to serve you in your time of need. And it's got to be an educational approach to work one-on-one with our patients, to let them know that, the days of Marcus Welby, I'm probably dating myself now, but the days of Marcus Welby are over, okay? Doctors are no longer looked at like Marcus Welby, the family respected friend that you would go to for everything. And that's just the changes that have occurred in providing health care. We need to move it back that way. And it was brought up, that Medicare is a great program, which it is, but I went into medicine not to make money. I went into medicine, I started off as a paramedic, and I went into medicine because I just wanted to help people. But let me just tell you that if you came into my emergency department as a Medicare beneficiary, and you were dead, you were in cardiac arrest, your heart was not working, you were not breathing, and I worked on you and I brought you back to life, okay, no matter what I had to do that. Do you know what Medicare pays me to do that? Anybody want to take a guess how much I get reimbursed? Bring you back to life? Who said that? I heard it was very close over here. $180, that was a couple of years ago. Yeah, we're up to about $220 now. $220, okay? Yet we can't talk about tort reform for the people who get $300 an hour to sue the physicians.
If you can find an attorney that only charges $300 an hour, you're doing well.
Okay, next question here. I'm sorry, there's not a name, so I'll just read it. Mr. Tarkanian, what are your thoughts on President Obama's end-of-life panels?
There's been a lot of discussion on that. In fact, Mr. Ralston on our show said that all the rhetoric that the conservative right is throwing out is not accurate about those end-of-life panels. I don't understand that issue well enough to comment on it. I believe that's something that we discuss.
It also should be noted that the Senate believed that it was left open to too much interpretation. They actually removed that from the bill. At least as it stands now, it's removed from the Senate version, yes. Is it Roe? Yes. Come on down, you're next. Price is right.
Hi, and thanks for the information, both of you. My question, let's see if I can read my writing. Why don't we allow people who are uninsured to get into the public option if they so desire, and allow those of us on Medicare and other insurances to keep what we have? There is a difference.
It's a good question.
I think that comes back to the same question that was asked earlier. Is the public option actually an option or requirement? And it is an option. There's no doubt about that, if I'm understanding your question correctly. The problem you have is when you create these public options, you get the government involved in a private sector business, and they're competing against all these other private sector companies. Now, these private sector companies can't compete with a government entity that is subsidized by taxpayer dollars. You run these private entities out of business, and then you're left with just the public option. And as I have stated, I believe on at least 2 occasions tonight, virtually every country that has socialized medicine started with a public option and it turned into socialized medicine. And that's not where we want to go in our country.
Would either of you support an option to where if somebody were to elect to go into a government-run system that they could do so? Would you allow them to pay for it while keeping the rest of us who choose to opt out of that option? So in other words, if they chose to go on the government system, would they be the only ones required to pay for it? Would we have to pay for it? In other words, to create an option where there can be no pre-existing conditions, but it would be run by the government, but we would not all be susceptible to it.
I believe that's the plan Obama suggested right now, and we would address it. It's not a mandatory plan. It's if an individual or an employer wants to go join the public option plan, that would be available. But as I've expressed, and again, you may have a difference of opinion, but I think if you look at the history of our economic society here in our country, every time you put a public government entity compete against a private enterprise, you run the private enterprise out, and you limit the competition, which limits the efficiency of the program and raises the cost.
And I think the other piece to that is that again there are programs similar to that already in effect. The Family Opportunity Act, which was passed back in '06, allows families that had insurance that reached their catastrophic cap, that had medically fragile children, to buy into the state Medicaid program. So there's an option for them to buy into Medicaid if they've had private insurance and they've capped out on their coverage. Now, I can tell you, and it's unfortunate, Nevada doesn't have, I actually tried to pass that bill when I was in the Senate, and it didn't get passed. But there are programs out there that are similar to that allow people to get in to the public plan. But to do that, you have to have the public option, which I think is what Danny is trying to get to, is that's the slippery slope. Because in the bill, there's commissions and committees that will decide what the appropriateness is of the private plans that are out there. And if your private plan doesn't meet what this commission or the healthcare czar decides is appropriate, then you won't be able to have that policy anymore. That's in the bill. That is in the bill where there's going to be a commission that decides what is and what is not a qualified health plan for the purposes of health insurance. And that's the slippery slope in going into a one-payer system.
Loretta Connor? Loretta, are you still here?
Yes, I'm here. I thank you for that. I do have my situation.
Hold on. Let's go to the microphone so we can hear you. We're going to start going kind of quick fire, like 30-second questions, and then we're going to go and open it up to audience hands as well very soon. So.
I'm in a situation, I have Medicare and I worked for the state of Pennsylvania for 23 years. I'm a nurse. And I have a private insurance through them, and they have, about 2 months ago, have discontinued that one. They are looking for another one. I'm wondering if that will still be there when they get this bill done.
Okay.
I don't quite understand the question.
Well, as I understand, right now your private insurance has already been canceled, correct?
Yeah. But I need another private insurance and a supplement or whatever, and that my PEBTF, which is Pennsylvania Employee Benefit Trust Fund, which is endowed, had an insurance, but they have canceled that because it wasn't good enough apparently or something.
So if you get more insurance, your concern is whether you'll be able to keep that if this is passed, is that correct?
Whether my state, this was part of my package for retirement, and which was all the retirement.
Certainly, I don't think neither Danny nor I can speak to what they're doing in Pennsylvania, although I did live in Pennsylvania. But that's a very complicated issue. And because it's part of your retirement, it's a retirement benefit, and it's a self-endowed plan, that actually doesn't even fall under this bill. It's what's called an ERISA policy, which is a different type of insurance that's not under local regulation. And so, since usually what happens in a trust fund with a retirement fund is if they cancel a certain carrier and a new carrier comes in, your benefit is intact, which your benefit is provided by the trust. It's not tied to the carrier. Now, I can't say that with 100% certainty in Pennsylvania, but that's the way it usually works in state benefits.
When I called in a couple of weeks ago, they said that they were working on it and they didn't know exactly what they were going to do, but I didn't know whether that was in the bill or not.
No, that type of issue is not addressed in this bill.
Thank you.
Did you want to go ahead and open it up, because I was going to have other general questions now?
Yeah, go ahead and start on your side, and then we'll work our way over here, try to get people who have not. And again, try and keep the questions very quick and concise. We're going to try and do kind of a quick fire and get as many people as we can.
Michael Roeder?
Senator Reid has made many outrageous statements that has embarrassed Nevadans. First, he said the president was a loser. Ordinary Americans are evildoers. And the most offensive to me, as a retired United States Army paratrooper, been in the Gulf War, was when he blurted out that the war was lost and hurt the morale of our troops. Would you, as United States Senator, make a pledge to refrain from making any anti-American statements?
We're the inflamed part of this crowd right now, right? You know, Senator, it's been well documented, Senator Reid has made some statements that maybe there was some better thought process he may not have made. Yeah, I'm not going to address, and I don't want to be here tonight trying to downgrade Senator Reid. Senator Reid has been represented our state for over 24 years in Congress, and he deserves that amount of respect. I will say, though, that I believe that we need to represent our Nevada beyond reproach as a senatorial character where we're not downgrading people. I believe the last election showed we're tired of partisan politicians who attack the other party they don't believe with everything they say, instead of trying to work together and build a unity and a compromise and get things accomplished. When I get to Washington, I want to be a uniter, not a divider. I don't want to be a divisor. I want to work together, and that's one reason why we have this healthcare
Henry Jingle from Henderson. Mr. Tarkanian, can you hear me? Here.
Yeah.
Over here. One of my longtime concerns is the medical savings account with catastrophic things. This would fit into your 20-year-old men that they could at least save for the future and also be covered when they get hurt by their Harley Davidson. What's your opinion of adding that since it's never been added?
Well, private health savings plans would help us purchase our own plans and keep through the lifetime, which is what I'm advocating. I'm very much in favor of that. It puts the power into the consumer as opposed to the government, and I'm all in favor of that.
David McCarthy? David? Whose name is on both sides.
Just want to thank you, first of all, for coming out and putting this whole thing together, because this is great.
Thank you very much. I appreciate that.
Mainly just had a question to everybody, actually, including you, just how some of the people here and some of the things that I've heard tonight, has everybody here ever heard of OPE, other people's experience? There's not been one country ever in world history that's ever made socialized public medicine work. How do you think they're going to make it? Question. I'm with you on what you were saying. I don't want to go into a long diatribe, but I could probably talk forever. But I agree with you on what you were saying about that. There's always going to be, different groups of people are going to want health care, and there's different groups of people that aren't going to be. And I don't see why that it should be forced upon everybody. There's no reason that everybody should be forced to have health care. Some of us don't even need it. There's people out there that why would you need to be a drain on the system when you've never been to the doctor once in your life? I'll take about your family.
David, do you have a question, though? You can.
That was me.
Okay.
I just wanted to say that.
Well, thank you for your comments, and thank you for showing up tonight. We all appreciate it.
Thank you.
My name is Debbie Turnage, and I have a question for Dr. Hackworth, Danny. You talked about the invincibles. I have a 24-year-old son who has done everything in his life right. He was a pillar for me when his father died, went to college. came back, got a job, has not been able to work for an employer that offered insurance. He's 24 years old and he's looking at medical bankruptcy for an appendix. At this very moment, he's walking around with a condition that I do have some medical background. I've talked to a couple doctors that I'm scared to death is cancer. And I can't get him no one will see him to treat him for that. We're at a point, we've planned the day, next Friday or the Friday before Labor Day, because he won't miss work. We're going to the ER. Because that is all I can do as a mother, afraid that my son may have a cancerous condition. What do you think, what about those group of people who do everything right, but just can't work for an employer that offers health insurance?
And I certainly empathize with the situation that you have. We do see it far too often. And you're right, the idea of the invincible is not buying it when it's offered is one thing. Not being able to get it when it's not offered is entirely different. And that comes back to there has to be the ability for an affordable product on the individual market that 24-year-old can buy. And so why isn't there an affordable product on the market? I can tell you why in the state of Nevada. Because Nevada is one of the most heavily mandated states in the country. We have over 54 service and provider mandates, which means that every insurance policy written in Nevada, regardless of who it's for, has to include coverage for those 54 mandates, whether or not that person would ever use it. Now, I'm assuming that your 24-year-old son probably does not need, is he single? Okay, so he probably does not need coverage at this point in time for mammograms, pap smears, OBGYN delivery, prostate exam, or colonoscopy. But you know what? He'll get it with the policy that he's going to be forced to buy in this state. And every mandate adds about 0.25 to 2% to the cost of a premium. So you can imagine, as Danny alluded to earlier, 54 mandates in Nevada, let's make it cheap. We'll go that each one is 0.25%. Okay? We've already added about 10 to 15% to the cost of the premium. There needs to be options for people to buy on the individual market, and that's where we need to concentrate not only federal efforts, but state efforts to allow those affordable options.
Woody Stroop, you around, Woody? Woody Stroop? Ready to take off? Okay, I'll go ahead and ask it for him then. His question was, Mr. Tarkanian, how do you plan to overcome the large amount of money that Reed has already been able to raise?
You know what's interesting about that statement is Senator Reed has been in Congress and the Senate for 24 years, and instead of espouling all the great things that he's done as a representative of Nevada, when he runs for re-election, he wants to proclaim the amount of money he's raising. I mean, it isn't about money. It's about how you've represented the state. This is about health care, so I'm not going to go on and on, but I will state this, that over the next 14 months during the campaign, we are going to bring to light what Senator Reed has delivered for the state and what he has not delivered for the state in comparison to what all the other states around the country are getting who don't have a Senate Majority Leader representing them.
I know that this is a meeting about health care, but there are other issues, and I think the most important one is the Constitution going to survive? Judges decide on laws. They make their own laws on the bench. Congress ignores the things that they should be doing. Advice and consent? How did we get over 30 czars? The executive has usurped the power of his office. He is now into health care. He is into taking over corporations, into firing corporate vice presidents. Where is the Constitution going? Isn't all of this of importance to us?
That is one of the main issues for a good segment of our Nevadans here, and it's a serious concern, and it's something that we're going to address during this campaign.
taught the Constitution for 36 years, and I'm frightened at what I'm seeing happen.
Okay. Well, first, though, I want to go through some of the cards I had for just a moment. Vicki Dooling from Henderson. Vicki?
My question is that people have had very good intentions before going to Washington, and we have elected them, and I know they plan on doing great things. I'm wondering how you plan on getting past the giant Washington machine.
Yeah, that's a really great question. I want to address that for a second, if you guys don't mind. It isn't really healthcare, but I want to discuss that for a second, because I believe the vast majority, if not most politicians, they get into public service because they want to accomplish great things to help our society. I don't believe we have many people that get into public service and they do it for self-benefit, although there's been some recently that we've seen that have gone to jail. I believe that people go in there with the right reasons, but then they get in there and they lose focus of what's best for the citizens of the state, and they're more worried about, am I going to stay in power? Am I going to be able to win re-election? How am I going to do so? I need the money from the special interest groups. Now, these special interest groups are given tens of billions of dollars. In fact, for the number 25 billion that Senator Reed's going to have. Now, those people want those elected officials who are receiving this money to vote on their legislation. Now, instead of going in there and doing what's right for the community and your constituents, you become a vote of these special interest groups. I can tell you that if I get in office, I know every politician or every public servant is going to tell you to say, I'm going to be different, I'm going to be different. But I dreamed about being in public service from the time I grew up. I went to law school just for that purpose. I have thought many times, particularly these past several years, that I'm going to go through life and not be able to accomplish something that I can feel great about, my kids can grow up and feel great about, that I've done something to help our society. To me, that's a lot more important than trying to seize upon power and retain a position. I want my kids and my family to be as proud of me as I am of what my mother has done on the city council. And there's nobody who can influence my mother.
In my life, I've been unemployed, uninsured. That being said, I'm a capitalist. I believe in finding my own way and earning what I work for. I don't believe in big government. Having read the bill, do you find that the government has access to things that should be private by nature? I just think that what I hear is that they're very heavily involved in the healthcare program and have access to our medical records, our credit card information, all of that, which I don't feel comfortable with. Did you find that?
You know, there is a reference within the bill that has caused a lot of concern. The problem for me with that reference is that it's very nebulous. And it talks about being able to determine whether or not an individual is capable of paying for the services at the time the services are rendered. Well, I don't know how you can figure that out unless you're doing a credit check or something at the time somebody shows up for services. Now, I don't know what the intent behind that is, because like I said, that's the way it reads roughly, but there's no explanation to go behind it. But I would be concerned. We passed EMTALA laws, I think back in the 70s, to say that anybody, there were certain places they used to call the wallet biopsy before you got taken care of. And that law says that anybody who shows up in a hospital, in an emergency department with an emergency, has to be seen, regardless of pay ability. And that's the way it should be in an emergency. I'm not sure what this reference in the current bill about verifying payer ability or payer source at the time services are rendered really means, but it does concern me of a little bit of too much big brother.
I have a question here that didn't specifically reference healthcare, but I think that it does relate, so I'm going to kind of improvise towards the end there and add on to it because I think it's something that maybe hasn't been addressed just yet. The question itself was, Mr. Tarkanian, can you promise that you will not become, as so many others in Washington do, who allow themselves to be bought and paid by special interests. Now, my little add-on to that is a lot of the argument surrounding this healthcare issue is the amount that people feel of special interest on both sides. They feel that, you know, the people opposed to it are being funded by, you know, big pharma and by insurance companies, and then on the other side that they're being funded by, you know, just unions and all that kind of hoopla. So, you know, where do you stand on that? Do you think that that's really influencing this debate and making it fair or unfair, or, you know, just where do you come down on that?
I certainly believe that the special interest money influences decisions that some of the lawmakers make in there. Some of them that are susceptible to re-election, that feel they need to raise more money to win their race, they may be influenced by that. There are some that are probably secure in the position that aren't. I can tell you, if I get in office, I'm going to get in office and do the right thing. I'm going to fight for what I believe is right, what I think is best for the citizens of Nevada, and there's no one that's going to influence me. I wouldn't put myself through facing a politician like Harry Reid and the type of battle it's going to take to beat him. I put my family through that if I wasn't going to go into Washington and do what was best and what was right.
My question's for both Danny and Dr. Heck. It's not healthcare related. I think we've talked enough about that. The president is currently going around the country and trumpeting the success of the stimulus, and that we're out of the recession already. And the stimulus is working, and jobs are being created. It's not happening. Unemployment is going up every single month. It's a big problem in the state, and I want to know what you guys plan to do about the current economic condition and to bring job creation back to the state of Nevada.
Well, that's one of the questions that I had from John Ralston when he put me on the show. He said, you know, Danny, the stimulus package, it looks like we're getting out of this recession, the stock market's going up. Well, look around what's happening in the state of Nevada, and we're concerned about the citizens of Nevada. We're not worried about if Detroit's getting higher employment because of the stimulus package. What's happening to the citizens of Nevada? We have 12.3 unemployment, the highest in the history of our state, and it's getting worse. You know, the stimulus package may have a small short-term effect to bring in some economic activity, but there hasn't been a time in our history where the government has imposed spending powers that have created long-lasting jobs. What has created long-lasting jobs is investing back in the private sector, giving tax breaks and tax incentives to the middle class, to all businesses, try to get tax incentives to get to hire more people and create more competition and more economic activity.
Go ahead. I think the thing about the stimulus, and I apologize because I don't know the exact number as of today, but just last week, 2/3 of the stimulus money hasn't even been released yet. So I don't know how that could be the cause of the turnaround. It's really the natural cycles that we see in our economy, I think, more than the stimulus, since those dollars haven't even flowed out yet to have an impact. The issue about the state of Nevada is a critical one. And we talk about economic diversification, trying to build better jobs, more jobs. There's been calls for broad-based business taxes. I think we need a broad base of businesses to be able to take us away from this ebb and flow that we see from our two primary sources of business, which is tourism and mining. And the way to do that is to go back and look at why companies aren't coming here. And I talk to those companies, and they're coming here because of quality of life issues. We have a terrible education system, and it costs too much to provide health care to their employees. And so they say, look, they're passing. I talked to a company from California not too long ago. They're passing right through Nevada on their way to Texas. And I asked them, how come you aren't coming here? They said, because you don't have an educated workforce. I can't ensure that my own kids are going to be educated, and it costs too much for me to give my employees benefits. So until we go back and tackle those issues, education and healthcare, using conservative principles, free markets, leveraging the private sector, and competition, until we fix those, we will never diversify our economic base here in Nevada.
I have two more that aren't healthcare, and I know that this one is healthcare, so I'm going to go ahead and let her answer her question.
Hi, I'm Angie Bottom, and I'd like to know just a little more about the electronic records, who's going to control that, and how does it work?
Angie, that would be a 2-day seminar for me to give you. But in a nutshell, there are already certain entities that have, a lot of insurance companies have EMRs already, where you can go to any one of their providers or any one of their facilities and be able to access the patient's medical record. Now, it's still kind of like in a lockbox. You got to have a password. It's not open-ended information that anybody can get to. And there are regional health information organizations, we call RIOs, that are working on trying to do that on a regional and state level so that people can have access to their medical information no matter where they go. And so that information, it's all web-based, is one option. Another option is to put the information kind of like on your insurance card that has a small chip on it that is readable in certain computers so that when you show up with that card, you show your insurance card or your whatever the card may be, that information is in there along with old EKGs that you might have had. You know, one of the biggest issues we have, I get an EKG, there's something on it. Is that old? Is that new? Is this a new heart attack? Is it an old heart attack? Boy, I wish I had an old EKG to look at, but all your records are at the hospital across town. If you had that with you and I could see it was the same thing, we just saved you and your insurance company probably a $20,000 hospitalization. That's the importance of electronic medical records. And so those are some of the ways that are being looked at it. Whether or not they can do it nationally would be very difficult just because of the infrastructure involved. But certainly looking at it in these RIOs and these regional groups is very important.
Is the government going to get their hands on it?
No, the idea is that the information is not accessible to anybody outside the, you would have the password. And so you would either have to provide it or get the access to it when you present it to your healthcare provider. It would be protected information.
Thank you very much for this opportunity. I would like to comment just a little further on the issue of diabetic amputations. I'm a podiatrist, and I'm the spokesperson for the Nevada Podiatric Medical Association and work with the American Podiatric Medical Association on matters that deal with healthcare, and of course, amputation is a very, very important aspect of what we do. We've written President Obama a letter. There were two very, very important points, I think, in that letter. First of all, we told him we're appalled by the fact that he's misusing statistics. He cites $30,000 to $40,000 as the outrageous fees that physicians are making, and more or less alluding to the fact that they're chopping off legs when they really don't have to be chopped off. And I hate to be so blunt, but that's basically what he's inferring. Actually, the $30,000 and $40,000 applies to the total bag of expenses dealing with an amputation, the hospital costs, the costs of all aspects, not only the surgeon. As a matter of fact, to amputate an extremity, a surgeon through Medicare is usually going to collect about $700 to $1,000. And that includes 90 days, doctor, you're familiar with, of post-operative care and all the complications that go along with it. So $750 to $1,000 is a heck of a lot different than $30,000 to $40,000, and it's appalling that the president continues to use these statistics in spite of the fact that he's been told they're not accurate. But this is a mixed bag. It's a very mixed bag. We have to applaud the president for his next statements regarding diabetes and amputations. He says that we have to further the cause of the prevention of diabetic amputations. 85% of the amputations can be prevented through simple foot examination once a year. And if that's something that he's going to promote, hey, I'm all for it. And for those diabetics that are listening over here, hey, or if you know a loved one that's a diabetic, have their feet examined once a year. Let's prevent those amputations.
That's a great point about the cost of $30,000 and how it breaks down. And, that's the whole issue with medical billing, which if anybody in here can tell me how it works, I'd be indebted to you because I'm in the field and I can't figure it out. And that goes back to the issue which is not in the bill, which in my opinion should be, which has to do with cost transparency and people knowing exactly what they're paying for when they go out and get something done, and being able to comparison shop of how much a procedure costs at certain facilities, and being able to look at what the complication rates are for that procedure at that facility. and what that facility's experience is with doing that procedure. Wouldn't you like to have that information before you decided where you were going to go have your cardiac bypass surgery? I know I would. Those are the types of reports I believe that are in there. So, as I say, an educated consumer is our best customer.
Okay, we have about 10 more minutes, so I want to make sure I at least get to the people who took time to write on a card. These are not healthcare, however, I did get about 3 of the same question, so here it goes for you, Danny. Would you be willing to sign on to the bill that I know Congressman Heller has signed on to that would audit the Fed? If you would be willing, are you for or against auditing the Federal Reserve?
I would be in favor of that.
I'm just going to go ahead and throw this out there because it's pretty quick, and then I'm done with the cards, and I'll let Casey handle the rest. Danny, do you obey your mother? Because I'm very concerned about her influence since she has given thousands of dollars to Socialist Democrat candidates. You want him to talk about his mother.
First of all, I love my mother, and I try to do what I can to make her proud of me. We do have a difference of opinion in a number of areas. Giving money to Socialist Democrats, I don't know about that. She's giving money to Republicans and Democrats. She has a lot of good conservative values that I have, and we agree with those. So I do. We have some things that we agree with, some things we disagree with. But I'm an adult, and I follow what I believe is best with the guidance my mother has provided me while raising me.
Can I just do my own little follow-up? And what's her thoughts on you running against Harry Reid?
She's scared to death. My dad is very proud and very happy, so we have a split family.
Does anybody over here have a question that has not asked one yet for Danny Tarkanian? I'll start at the front and try to work my way back.
Have you ever thought about looking at having the federal government's role in healthcare reform, or whatever you want to call it, deal with giving the responsibility of the 47 million or the 8 million or the 3 million to the 1,300 or the 1,600 insurance companies that cover healthcare? That's, in my opinion, the role of the federal government, is to give the opportunity to your capitalistic process that you have, but tell them you must cover the uninsured, which I think Dr. Heck said came down to 3 million. You have 1,300 or 1,600 insurance companies that cover health in this country.
Yes, and that's what we twist around from giving the responsibility to insurance companies as giving the opportunity to the individuals to be able to purchase their insurance. There are things that we can do to, and again, one of my big proponents on this healthcare reform is to get individuals to purchase their own insurance and make that available. One of the things we have to do is make sure insurance companies will provide insurance to people with preconditioned injuries such as was discussed earlier. But if we give individuals the right to purchase their own health insurance, which can't be taken away from them, we then allow them to control their destiny as opposed to having the government control it.
And Casey, answer, are you reading from the cards, or because I'll go back?
No, I'm done with the cards.
All right, I'm going to do the same process then. So just make it as short as you can because we're running out of time.
Danny, what do you really believe it will take? What is your plan, and what do you believe it will take to defeat Harry Reid?
All these very research supporters here. You want me to give away my game plan? Let me tell you, Harry Reid has all the advantages. He's the incumbent, he's got the power, he's got the organizational base, he's got the money, and the state leans towards Democrats with registration. However, the one thing all polls have shown, now this isn't a partisan issue here, I mean a partisan debate here. There's been 15, 20 polls that have come out, and one thing each one of them has agreed with is the vast majority of Americans are tired of Harry Reid's leadership in the Senate.
This is a health question. Will abortion funding be included in this plan? Because I don't want my tax dollars going to that purpose.
There's been some debate about this too, guys.
I certainly don't want it part of the plan. Go ahead, Jim.
You know, it is not specifically addressed. It's not. There's no word in there that says it will be or it won't be. But don't forget again, there's going to be these commissions that will be appointed that will decide what will and will not be covered after the bill is passed. So there's nothing in the bill right now that says yes or no.
Okay, we got this one.
First, I want to applaud to this crowd, the wonderful behavior here, which we didn't have in another meeting in this crowd. And I'm very proud about that. And we talked about the cost, and you mentioned about illegal immigrants, which made the cost of the healthcare system that we have now very high. One of the things that we can save money is not to provide this healthcare to illegal immigrants. But how are we going to solve the illegal immigration problem? This is my question. And I have an idea, and I want to see what you think about why we're not going to mandate our youth. I have a 19 years old son. I think in his age, he can give to the country 2 years of national service. And the national service will be either you choose to go to the army, work in the fields, work in the kitchen, work everywhere they pay you a buck, educate yourself so the illegal immigrant will not have where to come to work. Our own people will work, our own young people will work, and we solve the whole issue of illegal immigration.
The issue of illegal immigration is a very important issue, and it's dividing large segments of our society. There is the argument that, and we are a benevolent society, we need to take care of the illegal immigrants that are here, and we don't want them to whether it's not have emergency health care, education, these things. The key thing is how do you decrease or do the best you can to eliminate illegal immigrants coming into our country? Well, there's two things. The first approach we've discussed, which I don't think has the best results, and that is to try to get a stronger border patrol, the wall, the electronics, that's the first approach. The second approach is you eliminate the reasons the illegal immigrants are coming to our country and take away the reasons for them to come here. And basically that is the jobs, and again, it's to an extent, it's the education and health care that we provide to people that are here. Now, you can't deprive someone who's already here in our country emergency health care, but we certainly don't have to deprive a citizen of our country health service because we're overflowed with treatment that we're providing to illegal immigrants that aren't like threatening conditions. And again, it goes back to the issue that citizens of our country need to be treated first. I don't want to turn away an illegal immigrant who's in our country who needs emergency health care, but we can't turn away citizens in our country who need the health care because they're treating an illegal immigrant first. And then also I think we've got to come down harder on the employers who are hiring these employees. We're not going to stop illegal immigration by going after the employees, the immigrants that are coming over. You stop it by investigating, scrutinizing, and punishing the employers that are hiring these people.
I just want to point out that it's 7 o'clock, and I know there's so many more people with questions, so will you guys be available in the lobby after you get a drink and cool down for a minute if people wish to come in and ask you additional questions, or how are we going to do this? Or would you like them to email you or contact you? What can we do about the additional questions we have?
I will be here. Joe will probably be here. We'll answer questions in the lobby. I did want to say a couple things before we leave. I don't want my wife, who's been here and waiting for me, I don't introduce her. Give me a big hand. I want to thank Casey, Heather, KXNT, and Dr. Heck for being a part of this. And I want to thank all of you for making this a nice civil discourse. We don't agree on every issue, but we were able to discuss it. And for the most part, everyone was respectful of each other. Hopefully we all came away with something that's going to benefit us from here. Thank you very much. I also want to say, anybody who is supporting me, please go to my website at www.tark2010.org. I sure would appreciate your help. To win this race, I need the everyday people, the grassroots people behind me that are working as a united force, and I hope that you'll join me. Thank you guys very much for coming.
One moment before you go, Dr. Heck, just in the interest of fairness, if you want to put out your website as well.
Thanks, Heather. The website is www.heck for Nevada, heck, number 4, Nevada.com. Or you just Google it, heck, and it'll come up. It's one of the first hits on Google.
You guys, thank you so much. I am so proud of our listeners and the people that were here. We didn't want a town hall like the ones we see on TV.
Everybody was very considerate of the others, for the most part. I mean, there were some yays and doers and stuff, but it was everybody let the other people speak and express their views, and we didn't all agree with each other, but we all listened, and we had an opportunity to try to persuade the people in our position.
Okay. Anything maybe that was brought up that you hadn't considered, maybe to add to your opinion, or?
Well, there's a lot of things that you have to go over after these events, because when you're up there and you're running through so many things, when I go home tonight, we'll be able to digest everything, and I'm sure there's going to be a lot of good things that are going to help formulate my position.
Okay. Now, after having this, you plan on having one?
We're hoping to have one up in Reno a week from now. We haven't formalized it yet. I'm in the process of doing so, but I'm going to be up in Reno. I want a whole event up there. We can't ignore this type of discussion.
Anything else you want to add?
I'm just glad that you guys were here. I'm glad that we had such a great showing, and I'm really excited that people had the enthusiasm and the interest to be here.
Excellent. Thank you. And good luck to your dad.
Thank you. Appreciate it. Hey, thank you for coming. I appreciate
thank you. That was a good discussion. I thought there was a lot of good stuff there.
Both sides back and forth, and America's great.
Absolutely.
Nobody has to have the right answer.
That's right. First Amendment. It's a pretty beautiful thing, right?
Hey, Danny. I want to introduce you to this guy real quick. This is Dan.
How's it going?
Watching basketball, you love it.
Oh, yeah.
I just asked about volunteer.
I'd love to have you volunteer. Thank you so much. Really appreciate it.
All right. Thanks. I'll be in touch with you. Pete. Hi, Sean.
Bye, Sean.
Bye, Sean. Bye, Harry.
I gotta run. We're at the Libertarians.
Do shots with us.
And should we do the video? Should we invite Senator Reid to our next night?
Why
it's
won't
official.
Senator Reid do a town hall?
We're inviting him to the event.
Oh, fantastic.
I feel like a star with paparazzi. I feel like I'm with Paris Hilton.
I feel dirty.
The Oppo guy videotaping Dan.
Oh yeah, I've had my picture on so many Republican websites, it's hilarious.
Are you really?
Oh yeah.
Yeah, you can be on ours.
Sorry,
They say, watch out for this guy.
Hey, as an opposition researcher.
You're a decent guy, Sean. No hard feelings.
Oh yeah.
Yeah, let me know. I gotta drive the same day.
I understand.
We'll see you later.
See you, man.
You guys gonna out film each other? Wait, hold on a second. I want to have this is, and I'll tell you what this means later on. My over-the-shoulder jacket.
Can we get a copy of that film, Sean?
I think that might be an FEC problem.
FEC?
Actually, no, I guess not.
Yeah. You know where we're going now? Don't tell Sean. I don't want him following us over there, so just keep it quiet.
Sean, you supposed to follow us wherever we go?
Yeah. I thought it ended when we got out of the building. Yeah.
Well, I should say away from the venue, maybe. until you get in your car and go.
Is that it?
That's typically how it works.
Keep adding more and more to your responsibility. Oh, where are you going now? I can't tell you where we're going because Sean's filming us, but I'll text you. How long is your brother going to be with the kids? Long enough that you can come?
Yeah.
Okay. All righty. No, this way.
All right, I'll let you go.